I'm here as ever with Dr. Richard Scott, GP. Hello, Richard.
Andy, really good to be back.
Just for those of you who aren't quite sure who Richard is, you are a GP, which outside of the UK might be more well known as a family practitioner. So you're the first port of call when you've got a funny lump on your leg and you don't know what it is.
You're right. First of all, a call for everything from physical stuff, what's this mole, what's this lump, to mental stuff, why am I feeling so terrible? And quite oftenly and increasingly these days to spiritual stuff. I
Yeah.
don't know what to do with my life. It's just a mess. So yeah, that's the people come to us with a whole range of things these days. Where sometimes they used to go to vicars, ministers in the past, and now they seem to come to doctors.
Fine. I remember I went once. I had this funny little. I don't know what the medical term is. It's like where the blood blister stops at the skin, which isn't that
Mhm.
exciting at one level. I went to see my doctor. Said, "What is this lump? I'm a bit concerned." He says, "Well, I'm glad you came to see me, but I've never seen one here. This is fascinating." And he called his colleagues in. "Oh, you don't mind, do you? We've never seen one there before." And it was right in the corner of my groin. That night, we had a church family group thing we went to, and two of the people there were doctors. One was a GP, and the other one was a GP specialising in hospital kind of the diseases that you can't get out of hospitals, sort of virusy stuff. Anyway, his wife said, "Oh, I want to see this. This sounds fascinating." And I had to say to her, "I really don't think our relationship would be good if you saw this." And she went on and on. And her husband had to say, "Darling, I really think this is one of those you need to stop digging." Because apparently it was fascinating.
Yeah. Oh well, it's always good to be what we used to call fascinomas. It's always good the source of a fascinoma.
I was that night. Everybody else wanted to know what it was as well. No, not going there. That's not what I'm going to share with you. Right.
Everybody gets 5 minutes of fame.
I do. Yeah. It was that. So I was there on this bed in the doctor's surgery, and yeah. "Oh, come and have a look. Oh, that's fascinating. Oh, that's interesting. Thanks. My misery is your joy." Great stuff. Right. Let's move on to some questions. So I've got a load of questions here before me. We'll work through these one at a time. If you can answer these, fantastic. If not, we can always circle back in a future date. I won't put a clock on because that would stress me out, let alone you. Right, let's just dive straight in. Dementia and aphasia, are they in any way connected medically?
Well, aphasia is the inability to speak. And what we tend to see is that is a classic symptom of certain strokes that people can have. There are other causes of aphasia. The problem with dementia is it's more of a global decline, so it can affect all parts of your mind and your thinking. But yeah, for some people, it will affect speech. Not so commonly aphasia, total inability to speak, but dysphasia, speaking poorly, and making no sense. So yeah, they can be linked, but they're certainly not the same thing. And there are many causes of aphasia, and yeah, a sudden loss of that points to a stroke by and large.
Fine. Just outline really briefly, what's a stroke for those of us who may be a little bit less than certain?
Sure, sure. So a stroke is when you have the circulation in the brain is affected. It's three-quarters of strokes are due to a blockage of an arterial flow. So sudden blockage to the blood vessels from a clot or an embolus will stop the blood flow to the brain, and that part of the brain will die. And that's why we have this fast thing that's all over the buses and all over the news. If you see someone with facial weakness or it's affected their speech, and you've got a short time to do something about it, because these three-quarters can be reversed by blood thinning medicines, thrombolysis. So, but three-quarters are due to a blockage of the blood flow. 1/4 is due to a bleed, and that's why scans are very important. Which is it? The two, because the treatment for a bleed is obviously not to give thrombolysis, otherwise you make the bleed worse.
Yes.
And some bleeds need evacuating. So yeah, I mean, there's been great progress with this thrombolysis, dealing with blood clots. Fantastic progress. In fact, a good friend of mine, he had a stroke, and his wife was there, and she's a GP, and she spotted it, rushed him to A&E, and she said, as the needle went in to give him his thrombolysis, the droopy face, the loss of speech, recovered in front of her eyes.
Wow.
It's that good, and that's why people need to respond quickly.
Wow, there's a reminder, if ever there was one, to seek medical professional help quickly.
Sometimes it matters.
Yeah, very much. Okay, next one. Red wine. I heard once upon a time that it can be good for the heart, including recovery from heart surgery. Is this true or not?
No, this is a tough one. not least for those of us who like red wine, which I'm a member. Yes, when we were soon after medical school, so 40 years ago, suddenly red wine was a good guy. A small amount of red wine increases your lifespan, reduces cardiac events, heart problems. Meant to be a good thing, with a bit of a U-shaped curve. So if you think of a U at the top of the U, no red wine, well, your mortality is this side. You have a little bit of red wine, it drops. If you have too much, it goes up the other side. So there's a sort of optimum amount of red wine. I might say in the press recently, suddenly red wine's become less of a good guy and even a bad guy. And I have to say, I'm actually a tad confused to know whether it's good or bad these days. I suspect there's not much in it. All I would say as a Christian is undoubtedly Jesus drank red wine. When he turned water into wine at Cana, his first miracle, he wouldn't have done that if he hadn't approved of wine. Now I'm sure he's helping out some friends at the same time, but I think wine is okay in moderation, and at the moment the science seems to be a bit split, really.
Confused science, fine. Okay. Let's move on to this one from Anonymous. When I take a paracetamol, I always get quite constipated. Is there anything I can do to reduce or remove the problem? Or take something with it that might help? Or is there another painkiller that I could take that's similar to paracetamol that's less likely to cause the problem?
Yes, that's a shame, really, because it's such a mild painkiller with so little side effects. I mean, the first thing is the great majority of people who get constipated in the West, it's because we don't drink enough. It's not the fault of a drug. A drug might sort of bring it to light, but as we always say, we should poo like cows and not like rabbits. If you poo like a rabbit, by and large, you're not having enough fluid, fruit, or fiber to bulk it up. Cows poo as they do because they get plenty of fiber in their grass and plenty of water in the grass. Rabbits, obviously less so. So the first thing to do is to drink more, and then make sure your diet is good. So lots of fruit and lots of veg, and that tends to bulk, and also bran and wholemeal bread. So look at the diet. However, if you've done that and you're still having constipation from paracetamol, then yes, there's plenty of things to do, like taking a mild laxative like lactulose or senna, Movicol. There's a range of laxatives. I wouldn't go up the range for pain relief, because when you're going up the range, you're usually talking about codeine-containing drugs, which will definitely make you constipated in that case. So really, I would say stick to the paracetamol if it's doing the job for the pain relief, and take a little bit of something on the side if your diet doesn't solve the problem.
Okay, look. Right, let's move on to this one. Feed a cold, starve a fever. Is it rooted in anything medical?
Yes, these old wives' tales. That's a very good. I mean, the thing is, most people when they have a fever don't actually fancy eating. Actually, in a sense, one isn't going to feed a fever because you're just off your food. Certainly, what matters with fevers is drinking, because you can rapidly get dehydrated. So the fluids matter. So in a sense, you're starved from the fever because actually you probably don't fancy the food anyway. Feeding a cold, is there anything in it? Well, I mean, the cold's going to get better anyway, given a couple of weeks. And if you've got an appetite, certainly feed it. I mean, why not? Whether it makes any difference to the cold, not convinced.
Fine. It's interesting. Some of these old wives' tales, so called, I guess there must be some root somewhere of truth, but it's picking the truth out from the myth, isn't it?
It is, and science will sometimes say, "Oh, actually, the hundreds of years ago you got it right," but often, no, you didn't.
Fine. Just one on the cold. Cold with a cough. Now, we've had this. I've met loads of people. They've all said the same thing. We have a cold. We have a cough. When we were younger, the cough would come and go. Now it feels like the cold and the cough are just there for months and months and months. So my question would be, is that different colds, different coughs one after the other, or is that just how colds and coughs works today?
Yeah. Well, I mean, viruses, a classic upper respiratory infection, viral infection, will give you a cold to start with, sometimes with a snore, with a sore throat, maybe a sore ear, and then move down and give you a cough. So usually, if you have a cold, you're going to have a cough to an extent. Now, there are some viruses, and not least COVID, where they can make the cough last and persist, and it makes you sort of hypersensitive, your tubes, your big tubes, and you'll just keep on coughing. And then, of course, there's a whole group of patients, and I've seen these this week, where what happens with certain viruses, you get a slight narrowing of the tubes, an asthma-like reaction, if you like. And if that's the case, you'll get three things. You'll get a wheeze, you'll get shortness of breath, and a prolonged cough. And the treatment for that is they open up the tubes, which is when we use inhalers or sometimes oral steroids. So certainly the two go together. And if you have a prolonged cough, yeah, go and see a doc, because if you've got an element of tightness of the tubes, we can solve that very quickly. We can really help you.
Okie doke. Right, we're going through some different subjects tonight. Is urine, the colour of water, the healthiest colour to have?
Well, if you've got it the colour of water, that means you're drinking well. So yes, actually, that's almost certainly true. Such that people with dark urines, it's often an indication of disease. They're not very well. They're not drinking enough. They're more likely to have urine infections. Sometimes it can be symptomatic of other diseases. So by and large, if you're having very, very dilute urine, yes, it's a good thing. Except there are some conditions where people make too much urine, diabetes, mellitus diabetes insipidus being two cases. And so if you're thinking, gosh, I'm not drinking that much, but I've got all this urine, pale urine going out, and I'm peeing several times a night, and I'm going all the time during the day, then you need to see a doctor, because there are, sometimes excess is not a good thing. But if you're peeing normally and your urine is nice and clear and you're drinking well, then you're onto a winner by and large.
Righty-ho. Sticking with water but not urine. Right, so someone set a story in because they saw an actor, Mark Wahlberg, who has embraced cold plunges for a healthier lifestyle. So, cold plunges, health. What's the real truth on all this? Because there's so much information around, isn't there?
Need to do this as a topic, because this is we like hot topics on this show.
We do.
And this is it's been going for a few years. I'm trying to think of the country. Danish, I think, is a guy who's the sort of the mentor for all these cold dips. But actually, I think that's a really good subject, because if I'm going to look into the physiology, what it does to your body, why it's meant to be good for you, how cold is cold, and all the rest of it. So I think that's a bit too much to answer in one go. And I think whoever that listener is, thank you very much. You've given us an idea for another program.
Indeed. Yeah, we see that everywhere. Yeah, take a cold plunge, don't take a cold plunge. This long, not too long. We kind of understand that if it's too cold for too long, we're going to end up with hypothermia. So there is going to be you've got to be sensible, but yeah, we'll find out. That's good. Another topic.
Well, and we know that athletes, and that, when they finish running around, suddenly they have plunged into an ice bath. I mean, I'm glad to say that I never got to that level of athletics, because it sounds horrible. But it does seem to be good for them in terms of reducing injuries. So there's going to be something in it. But yeah, let's look at that in one fell swoop.
Excellent. I do actually remember the river dance. Not me personally, I didn't do it, but I remember seeing the dancers in river dance would come off stage and then get into an ice bath because it was apparently good for the muscles or something. But yeah, we can look at that more detailed. I think this is someone who's in disbelief at something you've said. Does a caffeinated cup of tea really help before you have some exercise to help you lose weight?
Well, it seems that the study was done on coffee, to be fair. So I can't comment on tea. I mean, one would imagine it might have the same effect, but we can't say it does because the studies haven't been done. So I can't say the caffeinated tea will do so because we haven't proven it, or it hasn't been proven. All the study shows is that a strong coffee, an hour before exercise helps you lose some weight. So no, we can't just say that's fine with tea. It'll have the same effect. You've got to prove it.
Fine. And then one last one we've got here. Please, can you ask Dr. Richard Scott, why is it so difficult to find a cure for the common cold?
Yes. Well, if there was one single virus causing the common cold, they'd have nailed it years ago, because there's been cures for lots of other viruses over the course of time, including COVID recently. But the thing about viruses, they're cunning little beasts, and they keep changing their nature. So we might call it common, but actually the virus that you get tomorrow may well be different from one in 3 weeks' time. It's always changing its nature because somehow the virus is aware. Of course, it's not a brain thing, but it knows that there is a battle going on here between the host, us, and the parasite, if you like, the virus. And they keep changing their nature so that the host can't just completely be immune to them, because it's in the virus's interest to get in our cells and replicate more of itself. So we may call it the common cold, but the viruses are constantly changing, and that's why it's a real challenge. Plus, I might say, I think what the researchers do is they target the really dangerous ones, the COVIDs, other ones, the nasty ones, particularly in Africa, like Rift Valley virus and others. Zika virus, some of the, these are the ones they need to target because these kill large numbers of people. And so I think they concentrate on those things because also they don't seem to change as much. Common cold is a little beggar.
Interesting. Okay. And then one that comes to my mind off the back of that is some people will say, oh, antibiotics, that'll fix everything. If I have a cold, I go to the doctor. And I've heard them say, I'm going to go to my doctor, I'm going to demand antibiotics. And I'm sitting there thinking, I don't think you're going to get antibiotics for the common cold. What's your GP's answer to that?
Well, yeah, you're absolutely right, and this is something we see. Even though people aren't always as expressive as that, that's the subtext. I mean, when they come in, I want an antibiotic, and antibiotics kill bacteria, and they don't kill viruses. Now, it's undoubtedly true that some people with a viral infection will have their body weakened, and then suddenly in comes the bacteria and causes more havoc. And then we treat the bacteria, and that gets rid of that, and then the virus goes away over a couple of or 2 or 3 weeks or so. But to come along with this sort of fairly sort of normal standard minor cold in your nose, sore throat, and a minimal cough, no, you're not going to get antibiotics from your GP because it's not appropriate because it's a virus. The antibiotics won't work. And then when people say, oh, well, I had antibiotics and it got better soon, well, it would have got better soon anyway because the antibiotics cannot kill viruses. It's not logical. Only when there's bacteria moving over the top. And that's where, if you like, the skill for us comes in when we see someone. Are they simply viral or are they a bit worse than that? So yeah, that's when we make a judgment call about whether to give them. And of course, antibiotics, getting it right matters because there's so much resistance to antibiotics now. And that's because, to an extent, we've overprescribed them over the years and the public have over-demanded them. And, we actually need to be tough sometimes and say, no, this isn't right. You don't need one and you're not getting one. Then, of course, if people think, well, I'm going to go and seek a second opinion and then third opinion and then turn up in A&E, sooner or later, they'll get antibiotics from somebody. And that's a shame because actually that's not helpful for public health knowledge and awareness.
One that threw me, which I've just remembered thinking about all this, is I had a lung infection. And when I asked the doctor at the time in the hospital, I said, was this like pneumonia or something? He says, we don't really talk about it like that because we just call it a lung infection. So a lung infection, is that bacterial or is that viral or can they be either?
Sure. No, well, there's causes of lung infections from viruses to bacteria to fungi. It's a whole range of causes. I think we probably don't use the name of pneumonia so much because it alarms people. In the days when I was a kid, you were a kid, and certainly before antibiotics, if you've got pneumonia, you're a goner. Proper bacterial infection without antibiotics is going to spread and kill you. So although it's a truth, we probably don't use the word as much as we used to because it's alarming. So we call it a chest infection or a lung infection. And but from time to time we'll see a really bad one in general practice, and I'll say to someone, look, I do think your child has got a small pneumonia there. We need to send them to hospital. It's going to need an X-ray. It's going to need IV antibiotics, etc. But I think for most people, we don't. If it's that bad, I'm happy to use the term. But if it's not that bad, I'm not going to alarm people unnecessarily. You've got a small infection. Let's get on and treat it.
That makes me want to ask one more question then. When you say X-ray the lungs, I had an X-ray, which they did for something else. They said, oh, you've got a lung infection. We wouldn't have known without the X-ray. So let us hit it with something strong to get rid of it before it becomes a problem. But how can you see an infection on an X-ray that I would imagine is only supposed to show bone?
Yeah. No, you're right. Normal lungs are simply you just see them as black on the X-rays. There's nothing there. But if they get an infection, they get what we say consolidated. They solidify and then you get white shadowing on the X-ray. So suddenly, yes, you're seeing something abnormal that would not normally be there. So that's what the radiologists, the X-ray doctors, are looking for is shadowing on the lungs. If it's a really bad infection, it might be spread throughout the whole of both sides, but more commonly, it's just a small patch in one part of the lungs. Oh, look, that's where the infection is. Hit you with antibiotics. Perhaps repeat the X-ray after 6 weeks, or when you come to see us as GPs, we'll have a listen and say, oh, look, all those crackles that we'd heard previously, because the shadowing is reflected in crackles that we hear. Oh, those crackles have gone. You're already telling me you're feeling better. Looks like the antibiotics have done their job.
Yeah, okay, fine. I just remembered I had an X-ray and thought, how did you know from an X-ray that I got? It threw me completely.
That's our game.
That's a medic doing their job, really, isn't it? That's the training, I guess.
Yeah.
Okay, let me I'll finish with this one then because this one shocked me, and I'm still not sure it's true. I was in hospital one time. I had that my muscle lumped in my back or something. This is going back nearly a decade, and the doctors in the hospital were great, but they couldn't unlock it. They tried all sorts of things, and at some point, he gave me this little cup. This very happy doctor, one of the consultants in the A&E, said, "Just drink this, Mr. Berry." Okay, so I drank it. He said, "Hopefully that'll make you feel better." And I said, "Well, what was that? Are you sure you want to know?" "Well, yeah, I'd like to know." "Yeah, that was cocaine," which threw me because it was this sort of Gothic looking fluid thing. Did I mishear?
Well, was it codeine or
I don't
cocaine?
know. I
Yeah, it's
thought you
probably
said
more likely to be
cocaine. I don't know what it
probably
was. It was a
codeine.
fluid.
I doubt he'd have given you cocaine, or he might have been struck off.
It just threw me. I thought, I'm
We don't
sure that's not
prescribe
right.
we don't prescribe cocaine. No, it's probably codeine, which is
Okay.
paracetamol. Often we give a small dose of diazepam for where muscles go into spasm because in addition to be good for our heads, it also just unlocks muscle spasm, say in the back. So if someone comes in with bad back pain, a lot of spasm, they pull the ligaments holding their spine together, and then the muscles go into protective spasm over the top. The spasm can hurt more than the original condition, so we give a bit of, in addition to general painkillers, we give some low dose diazepam, say 2 milligrams 3 times a day, just for a few days to unlock the spasm. So I guess it was probably codeine, not cocaine.
I always assumed I
At least I hope
misheard,
so.
but I was on some all sorts of drugs and they weren't working and they was getting stronger and stronger. So
Careful, because if this goes out, you'll have all sorts of people going to the A&E for cocaine.
yeah,
Free.
yes, no, it wasn't that. I remember it was a horrible looking liquid that didn't taste nice, and he was smiling as he gave it to me, but it seemed to work. Within half an hour, I was actually able to move
Jolly,
after.
jolly good.
Yeah, 8 hours of all these different things, plenty and plenty of gas and air Entonox. That wasn't working. So yeah,
Mm.
hey, it's fun. I mean, we're grateful for our doctors in nurses in the UK because you know what? Every time I've had to be in a hospital situation, particularly whether it's children, myself, my wife, it's just however overworked they are. All I've ever met are the most compassionate, hardworking people. They're great.
Oh, that's good to hear. And it's very nice because obviously there's lots of complaints about the NHS, and I saw somebody yesterday. Oh, I can never get to see a doctor. The usual thing. And certainly there's there are problems, but it is very nice when we have plaudits, as we call them, rather than complaints. That's
But
nice.
I like to feedback encouragement as well as when it's something's gone wrong. I like to point it out and also be encouraging because we all like a bit of an encouragement, don't we?
Well, and as Christians, being encouragers, being a Barnabas is important because as we all know, gosh, there's so much misery on the news around, and actually, there's all sorts of good things going on in the world which we don't hear about. So, yeah, encouraging. I think being encouraging is a good Christian value. Mm.
Absolutely. Great place to stop. Encourage your local doctors, nurses, and pharmacists and say thank you. Be polite, wait, be patient, and show them a little bit of joy, especially this time of year. Thank you, Richard, as ever. We'll be back next week for more. We will touch in the future. We'll look at cold plunges, the health values or not of those. And yeah, if you've got any quick fire questions, we'll do those every so often. But otherwise, we'll do topics. If you've got a particular topic, let us know. Hello at pure247radio.org. Hello at pure247radio.org. And we'll ask the doctor. Thank you, Dr. Scott.
Always a pleasure.
Take care. Bye for now.